Hello everyone. I just wanted to make a quick video to clear up any confusion on the differences between the CPT coding system, the ICD-10-CM coding system. We also have ICD-10-PCS and the HCPC. So how do these all work together? So I just am making a quick video to explain those. So let's first start with the CPT and HCPCS coding system. So the HCPC coding system, it's pronounced HCPC, like H-I-K-P-I-K, HCPC. It is called the Healthcare Common Procedure Coding System, and CPT is a portion or a part of the HCPC coding system. The HCPC coding system is divided into two parts. So there's the HCPCS and there's CPT. HCPCS are used for all the medical supplies, equipment, medications that a facility or a physician office might use. So, for example, a wheelchair, crutches, gauze, and then on the medications, if a patient's given an IV of Pitocin, the actual Pitocin, or if a patient's given, say, a prosthetic to put in their shoe. That is a durable medical equipment. Some of the supplies, the braces, the casting equipment, everything that a physician might use or any kind of clinician during the course of treating a patient would be a HCPC. And then a CPT on the other side, CPTs are for services and procedures. So think about something a physician personally does or performs on a patient. So an office visit, if a patient comes into the physician's office, there's an office visit that's used with a CPT code. That's how the physician is paid for seeing and examining and the medical decision making that combines from seeing that patient. That's an office visit, so that's a CPT code. If the physician removes, say, a lesion during that office visit, then the CPT code you would code for the lesion removal. If a physician sees a patient in the hospital in a same-day surgery setting for, say, a colonoscopy or a tonsillectomy and adenoidectomy, all of those outpatient procedures or outpatient services are reported with CPT codes. So any supplies that were used to provide those services would be HCPCS, but the actual service itself, so the surgery or the office visit, those are reported with CPT codes. Also, CPT has radiology, path, and lab. So CBC, let's say the lab at the hospital did a CBC test. That's a CPT code because it's a service. Okay, hopefully that makes sense. And now on to ICD-10-CM. So ICD-10-CM is the International Classification of Diseases. It's currently in its 10th revision, and the CM stands for clinical modification because it's the United States clinical modification of the World Health Organization. ICD-10 is adopted worldwide, but the US has our version, which is the CM, or the clinical modification. Now, ICD-10-CM is used by everybody in the United States to code for diagnoses. So diagnoses are what the patient is sick with, what they're coming into the office or into the hospital, or into the same-day surgery, or into the mental health clinic. Whatever illness, disease, condition, injury the patient is seeking healthcare services for is a diagnosis, and that's what ICD-10-CM is for diagnosis coding. Okay, so CPT is procedures, HCPCS are supplies, ICD-10-CM is diagnoses. Now we have one more, which is ICD-10-PCS. ICD-10, again, like I said, is the World Health Organization's coding nomenclature, right? The coding system. Well, in the United States, we have added the PCS portion called the procedure coding system. And this is the procedure code set hospital inpatient coders will code from. So we just learned a couple slides ago about the CPT, which is the outpatient or physician office procedure coding system, So in comparison, ICD-10-PCS is the inpatient hospital procedure coding system. So again, these are patients that are admitted as hospital patients getting procedures. The coder would code their diagnosis with the ICD-10-CM and their procedure with the ICD-10-PCS. Maybe they had say they were in a car accident and had like an intracranial hemorrhage and had to put in a cerebral ventricular shunt, or maybe they had an emergency appendectomy. Maybe the patient had lung cancer and they came in for a lobectomy. All the procedures that happen in a hospital setting for that inpatient hospital are reported with ICD-10-PCS. So just to recap, we have CPT and HCPCS, right? ICD-10-CM, ICD-10-PCS. So ICD-10-CM is used by everybody in the United States to report diagnosis codes. The differences really come down to procedure coding. Okay, so we have two different procedure coding systems used in the United States, CPT and HCPCS, which are used for, HCPCS are for supplies, CPTs for outpatient physician or outpatient hospital. Now, our second system is ICD-10-PCS, which is also used for procedures just like CPT, but unlike CPT, it's for hospital inpatient. So CPT is hospital outpatient, physician office, ER, all those outpatient settings. ICD-10-PCS is for inpatient procedures, inpatient settings. Okay, I hope that helps and good luck.